Let's talk instead about the NHS, another crumbling edifice currently operating in this country. They could do with putting a few billion into fixing up some hospitals, couldn't they? Roy Lilly's here, former NHS Trust Chairman. Roy, very good morning to you.
Morning, Mike.
I'm sorry to be the bearer of bad news here, but I'm not sure that this investment summit is all it's cracked up to be. Apparently, Wes Streeting, though, wants to have an overhaul of the regulatory bodies inside the NHS. You know a thing or two about the regulatory bodies inside the NHS. Is he right to do this? Are they all malfunctioning?
Yeah, it's the first time since he's been in office. I think I could agree with him. I give him my 100% support.
My goodness. Wow. I wasn't expecting that, Roy.
Everybody's going to switch off now. No, he's right. I mean, the Care Quality Commission is based on a very old-fashioned inspection regime. You know, you turn up and it's good. What you've wasted your time. You turn up and it's bad and it's too late. I mean, there's loads of ways now of assessing performance, digital and what have you. Yeah. So QC really needs a reboot. And then there's a whole load of, don't ask me how many, but I mean, there are a plethora of other organisations that have been added to NHS safety as issues have emerged.
Yes.
So what has happened previously? I mean, government have only got two levers, bungs and beatings. You know, if something goes wrong, they can throw money at it.
Yeah.
If something goes wrong, they can try and regulate it and beat it up. And so we've got a number of regulatory bodies that have emerged over time, and they all overlap. And it's become clear in the recent inquiry into the blood inquiry, as it was called.
Yes.
And people were given contaminated blood. The regulatory bodies all sort of blamed each other, and the truth lies in the gap between them.
Well, this is the thing.
I see the whole lot ripped up.
Yeah, no, we do. No, I mean, we've seen maternity unit having problems all over the place, not just the Lucy Letby case, but I mean, lots of other maternity units up and down the country have got very, very weird figures coming out of them, and some pretty bad, survival rates for children being born there. But apparently there are 6 bodies, including the CQC, as you say, the Care and Quality Commission. There's the National Guardian's Office, Health Watch England, the Health Services Safety Investigations Body, and the Patient Safety Commissioner, as well as NHS Resolution. I mean, I've never really heard of any of these operations.
No, well, let me explain. Resolution is of the NHS lawyers,
right?
And we can learn from their experience of, why does the NHS get sued? So there's learning there.
Yeah.
The safety body, that was one of Jeremy Hunt's ideas to try and base it on the same way that the airlines have investigations when things go wrong.
Yeah.
So they just look at it objectively and say, if the pilot had done this, they'd have all got home safely. Same kind of approach. And the others, they all add a layer of safety. What we really need, what has happened, Mike, in the time since all this has been going, is that we can capture data in a much better way. I mean, we've always had data, but it's been a big pile of paper. Right. Now you can actually analyse data, and you can put together stuff. So you can put together areas of deprivation. You could look at staffing, staff vacancies, complaints. And you can pretty much forecast where you're going to get problems. And the trick is not to turn up and beat everybody up and say, if you're a fool, if you'd have done this, it'd have been all right. The trick is to turn up and say, look, this is going in the wrong direction. What have we got to do to fix it? Now, a lot of it is around funding. A lot of it's around modernisation. A lot of it's around having the right staff. But it can be done. And we do need to move the NHS on to use the data to make it a safer place. So,
but you know as well as I do, Roy.
Always restricting.
Yeah, but you know as well as I do, Roy, that they won't address the things that really need to be addressed, such as, the number of people who are working in the NHS who don't do anything medical, the number of managers, the number of people who work in diversity and inclusion. They won't address any of that because that's against their principles. And so instead, you'll get no increase in productivity, you'll get no increase in modernisation, you'll get no increase and no return for the bucks that you're putting in.
I don't think you do with a lot of these organisations. I think making the place safer, it stops what we call failure demand. That's the demand that's created by failing to get it right in the first instance. So, there are benefits there. And as far as management is concerned, well, if you look at the Darcy report, which came out a couple of months ago now, I think we had a conversation about it. He actually says the difficulty with management is there aren't enough good managers in the NHS. And if you compare our management costs to other European countries, we're at the right low end. I mean, 2% of NHS funding is spent on the managing of the NHS, and a third of managers are clinicians. The difficulty is it's managed in a sort of pen and paper environment, and it's really difficult to do. I mean, I've run a hospital and I know how complex it is. You know, you've got over 50 specialties, you've got God knows how many departments. You know, trying to keep on top of it is horrendously difficult. So I do think, I mean, the next thing to have a look at as well is the regulation of the staff. If you look at the General Medical Council, the Nursing and Midwifery Council, all the other allied health professionals have their own regulatory councils, and they're all there to do the same thing. First is to find out who the individual person is working in the NHS, what their qualifications are on when they're qualified and where they're working, and a commitment to safety. You could do all of that in one place and save a shed load of money. Because
well, let's hope they do all those things, and I'll be the first to tip my hat to them and say well done for making it better, for making it more professional. Roy, we've got to run because we're out of time. Thank you very much indeed. Former NHS Trust Chairman, Health Policy Analyst, who thinks Wes Streeting's onto something if he can sort out these regulatory bodies in the NHS. We might have to pick this story up tomorrow because there's a lot to be said about this, and we haven't really done it today, so we'll pick it up tomorrow